Director of Programs for Pet Partners, and I'm really happy to talk about this topic today, which is really all about the steps a prospective volunteer can take to join Pet Partners as a therapy animal team along with their pet. If you are an existing volunteer or already a part of our organization, that's great. We love having you here. You're welcome to hop in and make comments and kind of build on some of the things I'm saying, because I know many of our existing volunteers have as much to share to help our prospective volunteers as I do. So I see folks from Reno and Virginia. Definitely let me know where you're tuning in from. I'd also love to hear what kind of pet you have, if you are a prospective volunteer. The other thing that would be really helpful for me to know at the beginning of this presentation is if folks have any specific questions or interests that they want to hear about in terms of Pet Partners and getting registered with your animal as a therapy animal team. So feel free to put those right in the comments, and I will hop in and take a look at that to make sure that I am hitting the things that folks want to hear. So again, would love to know where you're from, what kind of animal you have. Happy to hear breed. I see we've got somebody with a golden doodle, but I'd also love to hear species because it's important to me to know if we have some non-canine owners on the call today. And then finally, what I'd love to hear before I get started or while I'm going forward here is the types of questions and specific things you want me to cover. I do have some things prepared, but also just know that I have some colleagues and helpers in the comments who can help answer questions via text and sharing links and things like that. So don't hesitate, please. Any question is a good question. So in terms of what I am going to be talking about today, we'll be chatting about what exactly does a therapy animal visit look like? Where does it take place? What do our teams typically do? We'll also talk about what kind of animals can participate in terms of species, but also in terms of the types of things we are looking for in a therapy animal. I'll be sure to go over the type of commitment we're asking of our volunteers in terms of how often you volunteer and what that looks like. And then we will wrap up with the steps to become registered. And part of that will include going over things like requirements that we have for the program. So we'll get into that as well. Hi, Mary with Peaches, the Basset Hound, and Penny, the mini pig. Yeah, Peaches and Penny are famous Pet Partners volunteers. So thank you for joining us, Mary. In terms of where therapy animal visits take place and what they look like, a lot of our teams visit at hospitals, nursing facilities, rehab centers. So in that healthcare arena, senior homes, we have people visiting in schools and libraries. So those are the more educational focused areas. We also have teams doing animal-assisted crisis response, so being available when people are going through an acutely difficult time. We have teams volunteering in the criminal justice or the legal system. We have people volunteering in airports and on college and university campuses. That list is not exhaustive. I literally just rattled off the ones that I hear of most commonly, where we know our teams visit. But those are the types of settings where therapy animal visits take place. In terms of what a visit looks like and feels like, many of our visits are social in nature. They are meant to cheer somebody up. They are meant to provide a positive, happy kind of break from what might be going on in that person's life, whether they're receiving medical care or they're taking a difficult class at school. And when I say that these visits are social in nature, I certainly don't mean to suggest that they are not serious or that they don't have important outcomes. They certainly do. Many of these more social visits reduce isolation for people. And when we reduce isolation, there's obviously a lot of additional outcomes, positive outcomes from that. We also have some visits that are kind of a step beyond just being social, and they're offered at a time when somebody is going through a lot of stress, like at final exams on a college campus is a great example. Those visits are social in nature, but they're also being offered at a very strategic time for that person to help bring some of their stress levels down. We also have a lot of visits that are more structured in nature, where a team, for example, and this is just one example, a team might partner with a physical therapist, and the team might have the person going through physical therapy use a brush to, groom their cat. And that's a way for the person to work on the physical therapy they might need in their hand, their arm, their wrist, whatever it might be. And so in those cases, the physical therapist is very much in charge of and working with the client or the patient. But our team is there to assist the physical therapist and that client or patient in sort of achieving the physical outcomes they'd like to have from that. Obviously, as you can imagine, grooming a cat or a dog would be something that would really motivate somebody in those types of settings. So that can also be a type of therapy animal visit. The last type I really want to bring up, because it's one of our most popular and most common, are reading or literacy-based visits, where our teams will go into libraries or schools, and typically children will read to them. Obviously, we know pets, again, can be a great motivator. They're also not as judgmental for those learning to read who may be mispronouncing things or not sure how to read a certain sentence. Therapy animal teams can be really helpful in that type of situation. So I am going to just hop and look at the comments here now that we've talked about what a therapy animal visit looks like and where they take place. Most folks just saying hello and letting me know where they're from. I appreciate that. I do see a question in here about if only online therapy animal visitation is available right now. No, there is in-person visitation going on. We are going to get to that in just a few minutes in terms of what's going on with the pandemic. But I can say now, in case this person can't stick around, we do have teams visiting in person more and more each day. As you can imagine, there is some return to that normalcy with our teams getting back into these facilities. I'm going to move on here. Somebody had asked in the questions the types of animals, or the species of animals, I should say, that we register. So I'm going to list those off. We have dogs, cats, horses, rabbits, guinea pigs, llamas and alpacas, pigs, birds, and rats. So those are all of the species. About 93 or 94% are dogs. The rest are split among the other species, with cats and horses being kind of the second and third most common. Even though dogs make up an overwhelming number of our teams, we equally value all species. We would love to have more of our less common species participate, because in some settings, non-canines are a better fit, either because of the facility itself or because of what the clients, patients, students, what they might prefer. For some people, a bunny or a rabbit is going to be much more in that person's lane than a large dog. So those are all of the species. We are happy to have all of them. So let me just loop back a little bit to visits, because I talked about where they take place and what they look like. But naturally, it's also important to talk about what that means for you as a volunteer. If you join Pet Partners, what is your commitment to these types of visits? And I do want to share that you arrange visits yourself directly with facilities based on your schedule and availability. Having said that, even though you have, you are empowered to make your own arrangements, we do also provide a list of, or a directory, I should say, of facilities in your area that are looking for therapy animal teams as well. So you can also use our resources. You can use your own. We just know that there's a lot of folks who have in mind when they join us already the exact facility they may want to go to. And that's totally fine. Teams can visit, however, often or as infrequently as they want. I think it is really typical. And by the way, if you're a volunteer, chime in the comments and answer this. But in my experience talking to volunteers, most visit a couple of times a month. Volunteers, if you do differently, please feel free to share. There are some volunteers who visit every week. There's some who visit a couple of times a week. And then there's some who only visit a few times a year at special events. All of this is okay. The only limitation we really put on you in terms of time is that you cannot visit with your animal more than 2 hours a day. And that is for safety reasons. Most animals start to get fatigued at the end of 2 hours, even if all they're doing is kind of laying on a blanket at the library and reading with kids. That still can be a lot of activity, a lot of coming and going. Animals tend to get tired. And so we don't allow anybody to visit more than 2 hours in one day. That's really the only time limitation. The other things volunteers should consider in terms of time commitment is that you need to prepare your animal to go to a visit. I'm specifically speaking of bathing and grooming, because we do require that animals are bathed and groomed before they go on a visit, for obvious reasons. And that can take a little bit of time. Of course, then you've got to transport to the visit, do the visit, come home. And some animals need to kind of unwind or decompress. So factoring all of those things into the commitment is important, but really it's ultimately up to you how much time you want to volunteer. Moving on, I'm going to talk a little bit about animal eligibility. So you can decide, now that you know a little bit more about the commitment, whether or not you want to go forth is also dependent on whether or not you and your animal, specifically your animal, are eligible. I actually have to look at a list of this so I don't forget any one thing. I'm just going to pull that over on my screen. So let's review some of these eligibility requirements. For pocket pets, that includes rabbits, guinea pigs, and rats. They must be at least 6 months old. All other animals must be 1 year old. Birds, I don't know if we have any bird owners on here, but I'll mention it. They must have lived with the owner for at least 1 year. For all other animals, they need to have lived with their owner for 6 months. So let's say that you adopted a cat from the shelter who's 3 years old. That cat meets our age requirements, but it doesn't meet our other requirement until it's been in your home for 6 months. And of course, that's so you get a chance to really see your animal get comfortable, come out of their shell, because for anybody who's adopted a shelter pet, you know, or a rescue pet, you know that sometimes their behavior in the first month or two isn't the same as what it will be 4 or 5 months in your home. You know, they sometimes when they get comfortable can either get easier or they can sometimes get a little bit more mischievous as they're comfortable. So this is just to allow you time to get to know your new pet before you proceed into a therapy animal environment. All animals must be reliably house trained. All animals must be on a leash at all times, and this also includes our smaller animals. And then this is a big one. For the safety of you and your animal and the people you visit, all animals must be in good health in terms of they can't have any internal or external parasites. They cannot be on antibiotics, antifungals, or immunosuppressive medications. Now, if they're on a medication like that and they're already registered with Pet Partners, they can just take a break while they're on that medication and then return down the road. There's no problem with doing that, but they can't evaluate and become a team when they're on those medications, and then they can't actively visit when they're on these certain types of medications. No, when I say in good health, that does not mean that animals who may have a disability or even a chronic issue doesn't mean they cannot participate. They can in many cases. It really depends on if the issue or the disability causes discomfort or makes visiting a more a painful or uncomfortable task in any way. But we do have animals who can't hear. We have animals who only have 3 legs, dogs who are tripods. We have lots of that going on. It's totally okay in most cases. I would encourage you, if you have an animal with a chronic issue or a disability, or if they're on like a long-term medication, that you reach out and talk to us before you get too far in the registration process. That way, if it's an issue, we can let you know kind of sooner rather than later. I'm going to pause here and jump in the comments and make sure I'm not missing anything. So thanks to the volunteers sharing where they visit, how often they visit, the fact that they've been returning in person. Oh, great. We've got rabbit handlers on here. Always love to see that. I'm just scrolling through. Rena asks if therapy birds are uncommon. Yes, they are uncommon. They're one of our least common species, but we do love the birds that are in our program, and it definitely can bring an element of uniqueness to therapy animal visits. And it's a real treat for the people who are able to meet with a bird. I see a question up here about how do we get connected with the local groups. I am guessing that question is around, we have, for example, Pet Partners of Dallas. I'm assuming this person is asking about connecting with those local groups. On our website, we have what we call a community partner directory, where you can type in your zip code and see if there are any local groups in your area. That means a group of volunteers that work together in some way. I do want to take this opportunity to point out, though, that you do not need to be affiliated with a local group in order to be a member of Pet Partners. In fact, many of our volunteers are totally independent, or maybe they have somebody they know in their community who also is with Pet Partners, or a few people, but they're not an official group. You do not need to go through a group in order to visit. You do not need to go through a group in order to get evaluated and join us. None of that is required. So independent or not independent, totally up to you. If it hasn't already been shared in the comments, my colleague Julia can throw in the link to the community partner directory for people who do want to see what's in their area. I hope I answered that question right. I'm going to move on and talk about a few other things. So we've talked about requirements in terms of age and health and all of that, but you need to do more than meet the bare minimum in order to be a successful therapy animal team. And first of all, I want to talk about the animal end of the leash and what makes an animal a successful therapy animal. First of all, they need to be people-oriented, sociable, and friendly. And I like to follow that up with strangers, meaning they need to be sociable and friendly with strangers. Because when you were out on a therapy animal visit, you were encountering a lot of strangers. Even if you go to the same facility month in and month out, clients change, patients change, staff changes. If you're in a school, the teachers might change. Obviously, they might change every year. The kids change. So the animal needs to not only tolerate interactions with strangers, but like interacting with strangers. And I emphasize that so much maybe because, I had a dog, unfortunately, who's passed away a few years ago before I started working for Pet Partners. I really wanted to get him registered. And I thought, oh, he is just so wonderful. He's so gentle. He's mild-mannered. He has great obedience skills. He's affectionate, but he's not in your face. Just a lot of things that we look for in therapy animals. And I was like, and of course he likes people. He's super friendly. But then when I really backed up, I realized that when he first meets somebody, he's actually more reserved and doesn't really want to interact with strangers. He needs to meet you a few times before those kind of sociable qualities come out. But with therapy animals, I'm not at all saying they need to be exuberant about every stranger they meet, but they need to generally enjoy interactions with strangers, and strangers of all types. So men and women, young and old, they need to be accustomed to lots of different types of people. Of course, our animals need to have good basic obedience skills as appropriate for their species, but we are not looking for animals that could win an obedience trial, okay? We're looking for obedience skills that help keep your animal kind of calm and predictable, and so we know that they will respond to you if needed, like stay, when you really need them to stay in place for something. Like imagine a situation where you're volunteering in a hospital and a doctor is rushing through the hallways. You want to be able to tell your animal, sit, stay, so that the person can pass through. That's the kind of obedience we're looking for. It has a real purpose to it. A couple other things. This is specifically for dogs, although some of these apply to other species as well, but we want animals that can walk loose on a leash near its handler. Of course, like I said, they need to reliably respond to certain commands. Animals cannot jump up on people or equipment and furniture unless invited to do so, right? We don't want animals that vocalize inappropriately or vocalize in a way that can't be hushed by their handler. Animals should take treats nicely, or if they can't take treats nicely, then they need to decline treats. We'll talk a little bit about that with the evaluation in a moment. Animals shouldn't excessively lick people or mouth people. And a big one is animals need to be able to walk by other animals without displaying any extreme fear or being too distracted by other animals, or of course they cannot be aggressive towards other animals or negative towards them. And that's because if you are out visiting as a therapy animal team, even if you're by yourself, there are good chances that you're going to be with other therapy animal teams, either intentionally, like you are part of a local group and you scheduled to go together, or because you're crossing paths with other teams unintentionally. And those teams may be pet partners teams, maybe teams from another registry. It could be, especially if you're in like a nursing facility that allows dogs to be, or cats or pets to be brought in to see residents, you might see an animal like that. So we need to make sure that animals can pass each other without any sort of untoward behavior. So those are all the things we're looking for in the animal. But Pet Partners is actually known for the fact that we emphasize the human end of the leash as much as the animal end of the leash. The handler is as important as the animal to safe and effective interactions with the public. We, of course, want our handlers to be friendly and professional and polite, because our handlers are going to interact with strangers the same way that our animals are, right? We're also looking for handlers who can predict and redirect their animal's behavior. We call that proactive handling. Rather than reactive handling and allowing something that makes your animal uncomfortable to happen and then try to correct, we're asking you to be proactive about it, and predict and redirect that behavior. We also want handlers who can ensure their animal's well-being at all times. Your responsibility, first and foremost, is to your animal. And that's not because we don't care about the people you're visiting. It's because by you focusing on your animal, that's how you keep everything around you calm and safe, as if they become your number one priority. We also want our handlers to follow our Pet Partners policies and procedures. They are in place because they are tried and true methods, again, for keeping visits safe and effective. So we are always going to hold our handlers to our policies and procedures. And if those aren't followed, it can cause problems with your registration with your animal. We have quite a few policies and procedures. The one I already talked about was the 2-hour rule. Another one I've already talked about is your animal must always be leashed. So some of these I've already talked about, and they're pretty common sense, but we are looking for handlers who can follow those. I'm going to pause again and hop in the comments and see what's coming through. Yeah, Walter brought up, you are your animal's best advocate. That is a term we use at Pet Partners, and we acronym it by YAYABA. You are your animal's best advocate, meaning you are in charge of keeping them safe, thinking about their welfare, running interference if you need to between them and somebody else. A really good example I see handlers doing is, let's say multiple people want to come and pet your cat at the same time, and they want to all hug it. I have seen handlers do a lovely job just saying, hey, everybody, let's just stop there. My cat really prefers one-on-one attention. I would love if you could take turns petting my cat. It's a really polite way to say, back off, but because you're trying to keep your animal safe, but you're doing it in such a nice professional way, but it's making your cat feel as comfortable as possible. Even if your cat wouldn't negatively respond to multiple people petting it at the same time, if you know that they don't love that, it's not their favorite thing, then we want you to advocate for them, because for us, animal welfare isn't just about, is my cat properly fed? Does it have water? Does it have shelter? It's also about how can you make your cat feel as safe and as comfortable and as loved as possible. So advocating for their interactions to create that safe and loving environment for them is what we're looking for from handlers. So Walter, thank you for bringing up Yayaba. Just peeking here. I see somebody put in cats with a question mark. I don't know if that is asking if we do register cats. Yes, we do. Or if that is kind of registering surprise that we work with cats, but we have wonderful therapy cats in the program. Okay. I'm going to hop back to my notes and see what else I haven't covered. We're wrapping up here in just a minute with what I have prepared to make sure I talk about. So again, please ask questions, make comments. If you're an existing volunteer, please piggyback on what I say, give more information. This is all for the benefit of helping prospective teams learn more about how to become a volunteer. So I'm happy to have any help doing that. I think I'll talk about the steps to becoming a therapy animal team, because so far we've talked about visits, we've talked about requirements, and eligibility. And then we've talked about what makes an animal or a person a good member of a therapy animal team. So let's now talk about what it actually looks like to become a therapy animal team. The first thing you do when you want to pursue this with Pet Partners is to begin a volunteer center account. In the volunteer center, there is tons of information. We have a resource library in there where, let's say you have rabbits and you'd like to know more about how we evaluate rabbits. You can type in rabbit in the resource library. You'll get all sorts of great stuff about rabbits. Also with the volunteer center account, in your volunteer center account, is an area where you can launch your registration. You can begin it. So it can be Jesse Haas with JJ the dog, and I can start that registration, enter in my information and JJ's information, and then after I do that, I get all the steps that are required to become a team. And there are a number of different steps in there. I'm only going to focus on kind of what I consider to be the major steps, the ones that can take a little bit more time. Those 3 steps are taking the handlers course. That's the required educational component. The second is the animal health screening form. And the third is the team evaluation. So those are the 3 biggies. Let's talk about those. When it comes to the handler training, we have in-person courses and we have an online course. Both satisfy your handler course requirement. Right now, due to COVID-19, as you can imagine, there are not very many in-person courses, and that's because we have the online course. So by not offering those in person, we are not preventing anybody from starting the process with Pet Partners. Having said that, I just heard from an instructor today who is teaching a course. So in your area, there might be limited options for an in-person course if that's important to you. And some people prefer in-person learning. Some people prefer online learning. What I can tell you is that the outcomes for the teams are about the same. Meaning, if you take the online course or you take the in-person course, you have the same sort of ability to pass the evaluation and have a successful visiting career with Pet Partners. So don't allow the method of course to stop you from pursuing it. Because you're concerned one might be better than the other. Mostly the handler's course focuses on the handler skills that are needed for the safety and effectiveness I've been talking about the whole time. We're really trying to prepare you for success as a visitor with your animal. It is also, there are also some components in there, of course, in terms of helping you prepare for your evaluation and passing the evaluation. But it really focuses on the human end of the leash. The natural question we always get when I talk about handler training is, well, what training do you provide for our animals? We don't provide any training for the animals. And that's for a couple of different reasons. First of all species are different. So to provide training for dogs would leave no training available for the other species. The other reason is we really believe that handlers can determine themselves the type and amount of training that their animal needs. There are some animals that prepare for this for a couple of years. Maybe the dog is really young and exuberant and needs a lot of time before they're ready to be, a more calm or centered therapy dog. Others are coming into this role with a dog that already has a lot of those qualities in place that don't need to train for it. The obedience is already there. They're pretty much ready to go. Maybe they just need to do a little bit of brushing up at home. So we don't have required training for your animal. You do not have to provide that you have proof that you've done any training. We are all about training the human so that they are empowered to train their animal so that they can then be evaluated. And when they are successfully evaluated, we know that they are prepared to go out into their community and visit. We will talk about the evaluation in just one moment, but I do want to just briefly touch on the animal health screening form that's required for registration. That is essentially a form completed by your veterinarian. I already talked about the fact that if your animal has an ongoing health issue, please reach out and talk to us about it beforehand. But this is also the place where your vet can let us know. But mostly it's for us to know that your pet is physically able to participate and meet some of those physical requirements we talked about before. It also serves as a proof of rabies vaccination for the species who need to have that vaccination. Last but not least, let's talk about the evaluation. The evaluation lasts between 30 and 45 minutes. It is where you and your animal meet with a licensed Pet Partners team evaluator, and you go through a number of different exercises. Approximately half of the evaluation is all around kind of skills. It's a little bit more obedience heavy. The other half of the evaluation is about aptitude. What is your team's aptitude for this type of volunteerism? We really, at those times, try to simulate a therapy animal visit environment. So we will have things like somebody using a piece of medical equipment like a walker. We will have loud noises being made, because if you visit in a hospital or a school, you're going to have loud noises happen. We want to see how you and your animal respond to that. There will be exercises that simulate things like walking through a crowded hallway. Again, something you're likely to see in a hospital or a school. So again, half of it is more skills or obedience, and half of it is really around more aptitude for you and your animal. Always really important to point out that your score for the evaluation is 50% the human, 50% the animal. And that goes back to what I said before, that Pet Partners emphasizes the human as much as the animal. So your horse could come in and do a bang up perfect job, but if you're not doing your job as a handler, you will not pass the evaluation, no matter how perfect your horse might be for therapy animal work, or therapy animal volunteerism, I should say. So we do look at both sides. Naturally, at this point in time, I always get the question about whether or not evaluations are happening due to the pandemic. Yes, they are. In the past 2 to 4 weeks, we've seen a return to not as much volume as we'd normally have with evaluations, but we're getting close to 30 or 40% of normal in terms of evaluation slots nationwide. So what I'm trying to express is that, yes, evaluations are happening. They will be harder to get right now, but we see that the progression is towards far more availability as the summer goes on. So that might make you think, oh, there's not that many evaluations, I'm just going to put this off until things are more normal. I would actually advise against doing that. And that's because you've got to set up your account. You've got to take your handler's course. You need to visit your vet. You might need to do a little bit of training with your animal to get ready. If you wait until there's an evaluation on your schedule, in your area, let's say in August, you're going to be scrambling to get all that done. I advise people that just start the process now. It usually takes people a few months to work through it anyway, and then you can start looking for an evaluation. So that's typically my advice. I'm going to pause again and hop in the comments. So Shannon asked a question about if you don't have a regular vet. We do need to have a veterinarian sign off on a form, because it isn't just about vaccinations. There are a few other questions we ask. However, if you saw a vet like 30 days ago, because that was when your annual appointment happened to be, you can ask your vet to fill out the form now based on that veterinarian visit, if that makes sense. You don't have to go back just 30 days later just to have the form filled out. But otherwise, yes, we do need to have a veterinarian. Somebody asked, can senior pets be therapy animals? Absolutely, for sure. And I will tell you, my dad is going through the process right now of getting ready to go to an evaluation with his lab, who is 6. So she's not a senior yet, but she's getting there for a large breed dog. And I would say that for her and her personality, there's no way she could have done it before age 6. She just had too much puppy in her. So for a lot of dogs, especially, if we have any cat owners, you guys can hop in and mention if this is similar for felines, but sometimes they need to be more middle-aged before they even get started. And absolutely, we welcome senior pets. One thing I should mention is that Pet Partners requires reevaluation every 2 years. And part of the reason for that is so that we can make sure that your animal and you continue to be appropriate for the work. So if you register your animal at age 10, and maybe they successfully evaluate again at age 12, they'd have to evaluate again at age 14. And at that point, you might be thinking, maybe it's time for retirement. But an evaluator could also help you determine that. And that's one reason we do like to see teams, or require that we see teams every 2 years. Just scrolling through because I'm seeing a few other things. Nope, I think I got to the questions. I only have a couple more things to say here. First is around benefits of registration with pet partners. The big one is we provide liability insurance for our registered teams, meaning that you are covered when you go out and visit as long as you're following pet partners policies and procedures. And this is, a requirement of every facility our teams go to. There is a rare facility that will not require insurance for people visiting with an animal. So it's really difficult to do this type of volunteerism unless if you have an organization like Pet Partners behind you providing insurance. So that's the big benefit, or at least the tangible one. But also as part of your registration, you get access to hours upon hours of continuing education and resources to help you become a better handler. Again, our existing volunteers who are watching right now, I'd love to have you hop in the comments and chat about this. But once you start this volunteerism, it becomes such an important part of your life and your animal's life that you want more information, you want more resources, you want to get better, you want to take it to the next level. And so Pet Partners provides those types of education and resources to allow you to get there. That's a big benefit of joining our organization. There's a couple other benefits, of course, like you get a photo ID and a tag, which is, again, oftentimes something facilities want. You get a subscription to our Pet Partners magazine, and a couple other things like that. COVID considerations, and then I'm done. So I already touched on this a little bit because somebody asked if in-person visits are happening. Yes, they are. They're resuming at a rapid pace, especially as more and more people get vaccinated, although some facilities are not requiring vaccination either, as long as other precautions are taking place, like masking. So that's definitely returning to normal. We do have a lot of teams, especially during the height of the pandemic where vaccinations were not available, but people still wanted to visit. We had teams doing outdoor visits. We had teams doing visits where they were going up to windows and interacting through the glass, which is never as ideal as interacting in person. But for many of these visits, which oftentimes took place at nursing care facilities, that might be the only interaction those people had that day because no visitors were allowed inside. So we had people do drive-by visits, and some of that is still happening. So for teams who don't yet feel comfortable going indoors in person, or facilities who don't yet feel comfortable with having people come inside, you can do these window visits, outdoor in a courtyard visits, drive-by visits, and things like that. We do also have virtual visits available. I won't dive too deep into that unless if you have questions about that, absolutely type it in the comments and I'll get to it. So yeah, we're getting back to normal. And if you are a prospective new team, I think now is the time to get started so that you are ready to go by the late summer or fall, where I really feel like most facilities will likely be allowing at least some teams back in. And I am going to stop with my prepared presentation there. I didn't know that I'd be speaking for over 30 minutes. I hope that it wasn't too much of a drone. Would love to see more questions and comments. Mary Webb commented here that the canine body language course we offer to all of our volunteers has lots of good and useful information. I agree, Mary. This is, of course, all about being able to read the signals your dog may be giving in terms of how he might be carrying himself, how his eyes look, how his tail looks, how his fur looks, in terms of whether or not a situation is making him happy or nervous or neutral. I can tell you, as somebody who fosters dogs, taking that course has been really instrumental because we get to know our own dog signals really well, but different dogs have different types of signals, and the canine body language course goes through all of that. Marcy also shared, everyone loves the trading cards. Yeah, so you can get a trading card with your pet's name, their picture, and oftentimes on the back, like their stats, how long they've been a team and what breed they are and their favorite things to do. And people love those trading cards. I think especially the younger folks, but maybe I'm wrong, and people of all ages love the trading cards. I'd love to hear more about what's on your trading cards because I know people do them differently. So somebody asked here if I can discuss more about the evaluation. So they are evaluated on, again, basic obedience skills. So there is an exercise that is for dogs, sit. There's one that's down. There's one that is come when called. There is one that is out for a walk, where you will take your dog on kind of an L-shaped course, small one, not big, in order to demonstrate that your dog can walk loosely on a leash. So that comprises kind of half of the evaluation, maybe about 15 minutes or so. Then the other half is exercises that are meant to simulate a therapy visit environment. So they will be approached by somebody, you will be approached as a team by somebody using a piece of medical equipment. There is an exercise where 3 people will attempt to crowd around your pet and pet it at the same time. There is an exercise where you will be required to pass by what we call a neutral dog. So this is an animal that is invited to be a part of the evaluation. They will come into the room and you and your animal will have to pass that animal to assess what that looks like. There's obviously more exercises than that, but I'm trying to rattle off the ones that I think are most kind of demonstrative of what an evaluation looks like. If we have evaluators on the live, they can hop in and share a little bit more. But typically it's 30 to 45 minutes. You come in, you, your pet, the evaluator. The evaluator usually has about 3 assistants who are helping to kind of conduct these different exercises. It's just you all in a room. There's not tons of people observing you or anything like that. You kind of come in, you go through it. You'll usually be asked to kind of sit to the side when you're done or go in the hallway. Your evaluator will do their scoring. Sometimes they need 2 or 3 minutes to kind of tally it up and give comments. They'll come to you and they'll say, you passed, and here's the things that I saw, constructive feedback. Based on what I'm seeing of your animal and you, I think you would do really well in this type of environment or that type of environment. So they'll give you some guidance as well. If you don't pass, the score is called not ready. Not fail, but not ready. Because a lot of times teams come back on their second try and do just fine. Sometimes the nerves or the jitters are off or away. And a lot of times we do find that teams will not ready because the handler doesn't quite get the important role that they need to play in the evaluation. They kind of need to get into the role play of, I am in a visit. What would I do to keep my animal safe and comfortable in a visit? Once they realize, oof, I didn't do that well enough and that's why I'm not readied, they're able to come back and do that really well the next time. And then of course, carry those skills into visits. Lots of stuff coming in. Who conducts the evaluations and where? That's an awesome question. So our team evaluators, there are about 500 nationwide. They are senior volunteer leaders who have gone through a special course with Pet Partners to become licensed team evaluators. So they typically, almost always, are handlers themselves who have a certain amount of experience, and then they go through a 6-week course, and then they can evaluate people in their community. So they are volunteers themselves. So I always ask people, especially during the pandemic, to be patient and kind with our evaluators. They're doing this in their free time. Some don't yet feel comfortable doing evaluations, and that's totally okay. And then in terms of where they take place, like physically take place, it could be a variety of situations. We have some evaluators who use rooms in church basements, some who use conference rooms at their place of work. Many are able to use the facilities where they visit. So if they and their dog visit regularly at a nursing home, and that nursing home has a community room, they can often approach them and say, I'd love to hold an evaluation so that we can get more teams in our community and more teams visiting at this facility, and they'll be able to use that space. Obviously, because of COVID, a lot of these spaces have become harder to get, because even though facilities, businesses, whatever, may be allowing people to come back in, they're not allowing kind of non-essential business, if you will. And so if you do know of a space where evaluations can be held in your area, reach out and let us know, and we will connect you to one of those evaluators who would probably be super happy to have space available. I should also mention that in 2021 at least, and maybe beyond, but for sure 2021, we are allowing outdoor evaluations to take place. Typically, we haven't done that because most visits are not outdoors, and we want our evaluations to simulate the visiting environment. But right now, we are allowing outdoor evaluations to take place in order to help address some of our evaluation availability problem. I hope I answered your question, Jenny. Who conducts the evaluations and where? So hopefully I hit that. So where can volunteers submit their photos for social media use? Oh gosh. I'm not sure I know exactly where we want to submit them. Oh, colleagues in the chat, do you know? I'm not sure the best place. I'm sorry to say. But I tell you what, you can email anybody at Pet Partners. We'll make sure they get to the appropriate marketing and communications folks. Somebody asked if they can watch this live again. Absolutely. I think it's available from our feed. Rena, you can maybe hop in, or Julia, and answer that about how that's available later. Ooh, good. Please email your photos for social media to digitalmedia@petpartners.org. Digitalmedia@petpartners.org. It's in the comments too. We love social media pictures, especially if you're already registered with Pet Partners. Somebody commented in here, never release the leash. That's true. Don't ever release the leash. But at the evaluation, you are evaluated on whether your animal would come when called. Say if they accidentally got off the leash. It could happen. I feel like I heard a story when I first started here that somebody entered into the elevator and their dog was behind them, and the elevator closed much quicker than they anticipated. And so like the leash got separated. Luckily the door opened, but it got separated for a brief moment. And so in that case, we needed to make sure the animal could still come when called in the event the leash somehow failed. But yes, don't drop the leash. It's very important. All right, I'm not seeing too many more comments come in. So I do see one here. Nope, I answered that one. Sorry. So since I'm not seeing many more comments, I am going to hop off, but I do want to encourage you, if you have questions I didn't answer, go to our web page at the bottom, website. At the bottom of every page, there's a contact us feature. Submit your questions there. Say, hey, I was on the live. This is what I heard. I need more information, and we will make sure that we get your question answered. And with that said, I will let everybody go to have a wonderful Wednesday evening. Thank you for joining me. Again, I'm Jessie Haas, Director of Programs at Pet Partners. Have a wonderful day. Take care.